Welcome back. Many people rely on home remedies to treat dental problems, believing they are safe, effective, and harmless. However, misunderstandings about these remedies can sometimes delay proper treatment or even worsen oral diseases. This morning, we are joined by oral surgeon Kagiso Moloi to discuss common myths and misconceptions about home remedies and the impact on dental health. Doctor, welcome back, and it's always good to have you.
Good morning and good morning to Namibia. There's something very amazing with when it comes to teeth.
Yeah.
People treat teeth very differently. When you've got headache, this is your paracetamol.
Right.
When you've got headache, we don't do this.
That's a very interesting demonstration, doctor.
Do we put paracetamol on your head?
Absolutely not.
Absolutely not. What do?
You take it in.
You take it in orally. But the problem is when it comes to teeth, what people want to do this. They want to put the paracetamol in the tooth. And obviously, if your tooth is intact, nothing will happen. You'll be fine. But once your tooth has got a decay, that acid in the paracetamol or in any Compral or whatever medication is going to go into your nervous system, the nerve system in your tooth, and it's going to cause serious problem. Firstly, you're going to have a tablet burn, or we call it acid burn, and it's going to cause more pain to your nerves. Also, people take things like garlic. They put it on the tooth, but the problem is the infection is not in the tooth. The tooth is got a hole, but on the side you've got an infection. When you want to take antibiotics, what do?
Of course, take it.
You swallow them. They must go into your system. So you can't take a garlic and go put it next to the tooth that has got an infection. It won't work.
Why is it believed that when you put it exactly where the pain is, especially for the teeth, you believe that, or it's already believed that it actually will, treat it quicker?
Yeah, that's why I'm doing this demonstration.
Yeah.
Why do we do it with teeth? We don't do it with any other organ. If you've got a problem with your eyes, you don't take things and go put it on your eye. You're going to burn your eye. If you put aspirin there, you're going to have an aspirin burn on your eye, and you won't see again. So, putting things like garlic, it's a problem. So people also put ginger, onion, tea bags, turmeric, guava leaf.
Tea bags?
Yes. Because it's got a cooling effect, they freeze it and just put it on top of the tooth, and that becomes just temporary because of the cold. The cold usually reduces the pain.
Yeah.
And also, when they are swollen, they take a big scarf and put it around the head.
Yes.
The problem is with that is that when you've got yeast and you are cooking a cake that you want to or fat cook, when you want to make it raise, what you do is you warm it. You roll it with a cloth so that it can warm and start rising.
Yeah.
So the problem now, if you've got an infection and you keep it warm, you make it worse because you're actually breeding the infection. Instead of doing that, rather take a cold compress, take ice, put it there, and then you put your scarf on top of the ice so that it can reduce the activity of of production of more bacteria.
Very well. That's one remedy now that works, at least as far as we know, Doctor. Of course, what other remedies then actually would work? Because when it comes to teeth, just take us through that.
The one that would definitely work is coconut oil, because it's got it can reduce the inflammation, and also can reduce pain, and also oil of cloves. The cloves are known to be very it's got an anesthetic in it.
Okay.
So if you put it, even if it's inside the tooth, for a while it will come.
Relieve the pain.
It will relieve the pain.
Right.
So those are the best ones so far that can work inside the tooth. The guava leaves and all these are turmeric, and they actually exacerbate the problem later on.
Yeah, it's very important, of course, Doctor, that we try and make sure that we use these remedies, safely. But rather, I mean, what's important is that we use these remedies safely, at least before visiting a dentist or a health professional. What are the limitations that people should actually be aware of when trying out these remedies at home?
Yeah, the limitation is that whatever you're taking, it must go systemic. It must go into your blood, and you'll be able to go on to the source of the problem. So if it's not systemic, it's just localized, and something localized won't work much, because your infection is actually starts spreading. People end up with cellulitis, and people end up not being able to breathe anymore. They must go for tracheostomy and all that. And so localized treatment is not effective. The best treatment is to make sure you go to your dentist, who will prescribe proper antibiotics, which are meant for those bacteria. We've got different bacteria. We've got bacteria in the skin, which are normal commensal bacteria. So we've got bacteria in the skin, we've got bacteria in the ears, and they're all different. We call them normal commensal bacteria. If there's no problem, they are fine. But once they go above or there's an infection, they start developing and growing and giving a problem. So the only way is to kill them systemically. It's either you get an injection on your muscle, we call it intramuscular, or intravenous through the drip, and also intraorally by taking the tablet.
Very well. It becomes unfortunate, Doctor, of course, especially in the reality is that most people, especially those that are living in rural areas, would not, have access to all this, the remedies, or also, access to hospitals, for instance, where they can find. What are some of the tips that you can provide for them, especially those that are living in vulnerable communities?
Yeah.
What are some of the tips you can provide them?
The tips that I can provide is that they use those remedies, the home remedies, temporarily, but make a plan to go see the GP or see the dentist, so that the issue is resolved immediately.
What signs should I get that this actually then needs, serious doctor attention? Because at some point you feel, okay, there's a small pain, I can maybe survive it for a short while.
Yeah. When you lie flat, and you feel pain, more pain, and when you sleep with your pillows at the back, you like sleep sitting. If the pain reduces, that means it is an infection.
Okay.
But you'll need it attended to very quickly. And if you take your medication, like over-the-counter medication, antibiotics, something for pain, if it just lies down a bit and it quietens down, but it comes back, you need to go see the dentist. If you put whatever cloves, oil of cloves, coconut oil, and it keeps quiet for a while and it comes back, just go see your dentist.
The previous conversation that we had the last time we met in studio, of course, gingivitis that we, of
Yeah.
course, spoke about. Are there any remedies that can perhaps help heal that? Or perhaps just treat that?
The remedies for that, if after brushing your teeth, you still got bleeding gums, it means you need to go see your dentist, because most probably you've got something called calculus. Calculus you can't remove with the brush. So with calculus, you need specialized equipment, ultrasonic scaler, to remove that tartar, that hard substance that causes gingivitis. So there's no quick solution to it.
Yeah.
Just go see your dentist.
Absolutely. And what advice would you give patients to strongly prefer using at home, instead of seeking professional dental care? You share a bit of that,
Yeah.
but especially when the symptoms actually are persistent, you can see and you can feel that you have a lot of pain.
Yeah.
What does one do?
Usually most people become aware of their problem,
Yeah.
when the issue is persistent. Yeah. Once it starts becoming persistent, there's no reversal. You must just go see your dentist, who will either remove the nerve, called root canal treatment, or remove the tooth. So one of the two. It will depend at what level the infection is. If the infection is beyond, because the infection from the tooth goes all the way into the bone, into the alveolar bone. If it's in the alveolar bone, sometimes it's very impossible to reverse that problem. So the only way is to get rid of the tooth.
Absolutely. Is the paracetamol working?
No, paracetamol is not working.
Very well. Thank you so much for the demonstration, Doc. And of course, always a pleasure to have you in studio to help our viewers, of course, understand on all topics when it comes to oral hygiene and, of course, how to take better care of ourselves, of course, when it comes to dental health. Thank you so much, Doc.
It's always a pleasure.
Absolutely.